Hi, this is Dr. Anilek at thegeneraldentist.com in Shelby Township, Michigan. Our phone number is 586-247-3500. And you might be asking, what the heck are you doing with a blood pressure cuff on and a piece here on my finger? And if you've gone into the emergency room or the doctor's office, you notice that they obviously take your blood pressure. And what I wanted to do is just to explain some of the safety precautions that we use during our oral sedation. We are a member of it's called DOCS, which is an oral sedation certification for doing oral sedation in a safe and very effective manner. Our whole staff went to Chicago recently at this course and got certified for doing that. And what I wanted to do is just to explain a little bit about what to expect during a sedation appointment and maybe what some of it is. First of all, I'd like to come down here. This is what's called the nitrous oxide. Nitrous oxide has been used for many years. Nitrous oxide is a it's an inhalant, and so this would go onto a patient's nose, and then they breathe in and out of this little nose piece here. What this nose piece has is there's a mixture of what's called nitrous oxide and oxygen. And we have a regulator here at the base that will allow us to move this up and down, and it will mix oxygen either from 100% oxygen to a maximum of 30% oxygen to 70% nitrous oxide. So it will, the most you can get on this is 70% nitrous oxide. Nitrous oxide is a wonderful, very short-term, it allows for a certain level of relaxation, kind of a little buzzing feeling. And the beauty is since it's inhaled, when you're done with a procedure, a dental procedure, we can turn it down to oxygen and bring 100% oxygen in and breathe it, and over time, and it doesn't take but maybe 5 or 10 minutes, you're back to normal, so you can drive. The benefits of nitrous oxide, once again, it's very short term. There are really not a lot of restrictions to it. Most everybody is qualified to use the nitrous oxide. They can, very few people it's contraindicated to, so it's very beneficial. Most all of you have heard of the gas or laughing gas. That's another name for the nitrous oxide. It works very well. We use nitrous oxide sometimes on patients if they are just having something small done, or if they just are a little bit nervous about a procedure. On the nitrous, just in case you're interested, if you had this done before, the oxygen and nitrous is supplied through this bottom tube here, and so you breathe it in through the nose, and then you breathe out, and this part here on the top is part of what's called a scavenger. Scavenger is hooked up to our suction, so we have a unit that provides a vacuum all the time in the office. That's what allows things to be sucked out of the mouth. And for example, that suction is attached to this nose here, so it provides a negative pressure. So when somebody breathes out, the nitrous oxide goes into these tubes here, goes into our suction, and it gets ventilated outside. So what it does, it provides a safe, healthy environment for all of our staff to be in, and it also provides just the fact that you can use it just localized in someone, and it goes right back out. So it's a very safety precaution at you. So that's what those two tubes are for. When we do sedation, not necessarily just using nitrous oxide, when we do a deeper level sedation called oral conscious sedation, we will actually monitor your heart rate and blood pressure during the process. This here is called it's an oximeter. What it does is it measures the amount of, you can see on here, this top number here is 56. That measures my pulse rate. It also measures the amount of oxygen that I have in my bloodstream. So it's at 92 now. I'm kind of talking like this now. Over the next few seconds, I'm going to start breathing in heavily, and I'm going to oxygenate my blood a little bit more. And let's just see if that happens. It goes up. So it's 92 before. Now it's at 97. So I breathe a little bit more. In my body, I'm getting more oxygen into my blood. This is detecting it. My pulse rate's gone up a little bit too. What this does is it gives us the ability to see if someone's respiring enough during the process of when they're having the dentistry done. This allows us to, if it falls below 90, then we have to let them know, hey, take a couple more deep breaths, let's get that in. If we need to supplement, we can put the oxygen on. That'll also increase the amount of oxygen that's in their bloodstream so that they can perforate the brain. They'll have no issues at all. And there's no issues usually, you know, we have a very, very safe level. Also with this too is we have a blood pressure cuff, and on this blood pressure cuff, this will automatically inflate every 5 minutes during a sedation process. We will go ahead and monitor that blood pressure just to make sure someone is what they're doing. So we want to monitor their blood pressure, their pulse rate, and the amount of oxygen that they're breathing in, just to assure that they have a healthy blood flow and healthy oxygen flow in their body. We also have, this is hooked up, this wire there's a wire that connects up from our computer. What it does, it actually helps to monitor it, and it actually will put the data in, and so we have a good level of data that we can keep track of during the entire process. So for example, I have my clinic coat on here and my shirt. It's not able to take a blood pressure reading, so it'll try it again. So we'll see what happens with that. During oral sedation, we put usually a little sleeping pill, called a benzodiazepine. You'll take one at nighttime, usually a Valium at night, to help you to sleep, and then we use in the morning about an hour before your appointment. You're also given a pill to take, and then that will help you get relaxed. You come into the office, and normally we'll give you one more pill. And what that does, it just gives you the ability to have a lot of dentistry done, very little memory, and it's wonderful. It's for our high fear patients who just have an issue with dentistry. So, okay, there you go, got it. So my blood pressure is 134/79. So, anyhow, these are some of the precautions that we do take at our office at the General Dentist to have a safe, effective sedation, whether it just be using nitrous oxide on itself, or whether it's using our oral conscious sedation to help sedate them. By the way, if you do have the oral conscious sedation, you do need a driver, and you have to plan on being pretty inactive that day and not making any major decisions for yourself. So if you're interested, give us a call, 586-247-3500 or thegeneraldentist.com. Thank you.